After logging into the MTAP website, you can scroll down and go to My Patients, and then you can search for the patient that you're looking for. Once you're in the patient's profile, you can go to Test Portal, and you'll be able to see any tests that they've taken in the past. So I'm going to scroll down here, and I can see that this patient has taken 2 MTAPs. I want to compare them to each other to see if there's been any progress over time. So I'm going to select both of those, and then I'm going to scroll down until I see the Workability Report. Here's the Workability Report, and you can see there's a bunch of pictures underneath of here. So it'll populate with the pictures of all of the items that the patient rated that they have difficulty with. When generating the report card, it's helpful to include pictures of things that the patient has difficulty with. And it's helpful to select tasks that are related to the patient's job. So this is a shoulder patient, and this patient's in construction. So I'm going to select images that are related to his job. So I'm going to use this one with the handsaw. And then we'll use the sledgehammer as well. Once you have your image 1 and 2 selected, then you can hit Generate PDF. It'll download on your computer, and you can click on it to open it up. So this gives us a lot of really good information. It gives you their change in scores over time on this graph. It indicates what their PDC categories are currently as compared to what they need to be doing to return to work. And then it gives you some pictures at the bottom. There are so many benefits of using the MTAP Workability Report, especially for your work comp patients. They can demonstrate if they're ready to return to work based on PDC categories. It also illustrates improvements, any declines or plateaus in progress on the graph. It illustrates functional activities that the patient is struggling with. And maybe most importantly, it justifies asking for additional therapy visits and assists in getting more visits approved.